Well, the first time in our history, chronic disease is killing more people than infectious diseases. In 2007, we estimate that 77% of all the 5.1 million deaths in the region were caused by chronic disease. So it's a very substantial problem. There are a number of different lines of activities that we can be doing, all the way from the point of service to a global level meeting like what the UN and partners are organizing in New York City in September. The UN high-level meeting is critically important to mobilize the necessary political commitment required to really make a difference, to save lives. Now, this kind of meeting on health is the second time the UN has had a meeting specifically on a health issue. The first time was with AIDS, HIV infection, and the impact that that meeting had on bringing together high-level leaders from around the world and their subsequent commitment to the prevention and control of HIV was incredible. And I think that over the last 10 years has really helped with equity and access to the antiretroviral treatment that is required for controlling the infection and providing people that are infected to live longer lives. So, given that example of the enormous impact, we are very, very hopeful and expect that the impact of this meeting will be similar on chronic disease. So we're very optimistic that this will have a very beneficial impact, particularly where the chronic disease is occurring among vulnerable, poor populations. Not only from the years of work, the dedicated people working on chronic disease that in the past has not been given enough attention or political commitment to achieve the success that we're hoping to achieve after this meeting. Last year in October, the Healthy Caribbean Coalition had a conference that actually launched the efforts leading to the New York City high-level summit. There have been a number of meetings all over the world that focus on civil society in some venues or non-governmental organizations or governments themselves. And these meetings have taken place in Moscow, for example, Mexico City, also Argentina. And we at WHO have had a number of meetings taking advantage of our governing bodies process, where this last June, during our executive committee meeting, this was an important agenda item, and will be in September at our directing council, which is our annual meeting of all the ministers of health. So we're doing what we can using the opportunities we have with our governing bodies, but also networking. This month we're going to have a number of teleconference distance interactions with our countries to be sure that everybody's engaged going into New York City in September. Well, one thing that we're currently doing that will be linked to work after the meeting is preparing a technical document that will serve as a basis for revising our 2006 Regional Strategic Plan of Action for the Prevention and Control of Chronic Disease. So it will be very important. New technologies have become available, new strategies, new tactics, that we include and update this in our strategic plan of technical cooperation in helping countries. And then after the meeting, we want to be sure that this is not just a one-off meeting, that we link this to a number of other activities and we keep the momentum going. For example, the American Public Health Association is having a meeting in November, I believe. One of the topics will be healthy aging, the changing demographics of our societies and how chronic disease is linked to that. So that will be important. PAHO will be actively engaged. Thereafter, in April of next year, at the World Health Day, our annual World Health Day event, which celebrates the birthday of the World Health Organization, healthy aging will be the theme. And of course, chronic disease is linked to this, so we'll bridge all this momentum and hard work and keep it going well into the future. grounded in what will be a newly revised strategic plan of action. We'll also present that plan of action to next year's Directing Council meeting for Ministers of Health approval, and a resolution, again maintaining the momentum going forward.